So I don't really understand. Some providers, I have a problem with when we see our patients and we tell our patients that they're pre-diabetic and their A1C, their hemoglobin A1C is 6.4%. Why we don't tell the patient that them diabetic? Tell the patient that them diabetic. Them pre-diabetic, but tell them that them diabetic. Because if them go ahead and eat a sandwich tomorrow or the same day, then basically diabetic. Because guess what? Diabetes starts at 6.5. Them hemoglobin A1C start at 6.5. So when you sit down and tell a patient that their hemoglobin A1C is 6.4%, and you're gonna wait 1 year later to repeat their hemoglobin A1C, that speaks poorly about you as a provider. You're not really take care of the patient. You're not interested in the patient. You're not interested in the patient, Because if you are a good provider, you would bring back the patient in the office and get their A1C rechecked at 3 months' time to make sure that they are aggressive about getting their A1C rechecked and they don't get into the diabetic stage. How is it that you have a A1C, a hemoglobin A1C at 6.4, and you're going to wait 1 whole year to repeat the patient A1C? So you're going to wait until the patient is diabetic before you actually repeat them test? I'm sure that the insurance companies will be more comfortable with you doing a 10 hemoglobin A1C check throughout the year to make sure that patient hemoglobin A1C is well controlled and not get into a diabetic stage where the patient is going to be on either insulin or oral medications. Following up with endocrinologist and doing a bunch of blood work, or being admitted throughout the year and be spending a lot of money in the hospital, you understand, because of that diabetes. I'm sure the insurance company would be comfortable with all of that spending for that hemoglobin testing, that simple hemoglobin testing, than to do all of that spending in the hospital or the outpatient setting to get that patient to a normal A1C. When you have a hemoglobin A1C that is 6.4, that is no joke. Don't sit down with your patient and tell them that they're pre-diabetic and you'll see them in 1 year time. That don't make no sense. We need to be a little bit more aggressive when it comes on to our patients. When we see that, yes, their hemoglobin A1C is 5.7, we know that they're pre-diabetic. If you come back again and you see where their result is 5.9, yes, they're pre-diabetic, but they're heading in the wrong direction. Tell them that you'll see them in 6 months' time and repeat their labs. But don't wait until 1 whole year before you get a repeat and then what happen? You see the patient yam down the whole year and their hemoglobin A1C is 9. We can't do anything for help them patient there again. Things gone bad for those patients. So let's just try to see how we can help the patient, and don't let it be a case where, it's only annual visits, or it's only because, yes, the insurance says, or because they just feel as though you just need to see the patient once a year or twice a year, or you just need to do it, every 3 months. No. Let's just look out for the patients, be their advocate, talk to them and explain to them the importance of the checks so they can agree to it and come in to see you a little bit more frequently to get their checks done, even in the pre-diabetic stage. If they're at a 6, let them come in a little bit earlier. If they're at a 5.8, let them come in a little bit earlier and get those checks done. But don't let it be a case where you see the numbers trending up and you don't repeat the test before their annual visit. Sitting down with them, for 1 whole year and their numbers are abnormal is not doing any good for them. Have real conversations about testing, dieting, weight management. You understand? So that when it comes on to their annual wellness visit, you can all be happy with the results that you're discussing. So that's one thing I realized. Some patients, they're not happy about certain things. And so you realize that they're switching providers. They're just switching providers because providers are not being honest and they're not working up the patients a lot. They're not working up the patients a lot of time. When it comes on to their cholesterol, they're not doing frequent testing. Every 3 months, my pre-diabetic patients, every 3 months, if I realize that their numbers are trending in the wrong direction, every 3 months I get a test. And I've never gotten those patients denied by their health insurance for those tests. If we see that it is at 5.8, 3 months later, they might get a test. If it is at 6, 3 months later, they might get a test. It's the same thing for them cholesterol level. If the patients are on multiple medications, every 6 months they might get a test. Because I'm looking at their numbers to make sure that renal function is good. May I look at them thyroids. You understand? So we can adjust them their medications. I'm looking at it. No patients that I'm seeing is getting blood tests only once a year. None. So everybody cholesterol level is well under control. Everybody A1C is well under control. Everybody thyroid is well under control. Them PSA is well under control. I'm getting those numbers down to close to normal. That is my goal. So we need to do a little bit better. We need to have more conversations. Get the patients back into the office and have real conversations with them. Them have the insurance. Let us name out the insurance and make sure that the patients are doing better. Make sure the patients are doing better. If the insurance are not denying it, the insurance companies are good with it. Let us advocate for the patients so the patients can have better quality of life. But don't let it be a case where you see the results are abnormal and we don't repeat the testing. We don't repeat the tests for these patients. What the sense am I come to no? What the sense are coming to you guys? Anyways, let me go back to see my patient. Enjoy. And you can leave your comment down below. Leave your comment down below. It's just frustrating sometimes when I see some patients and they're saying that, oh, we never want to continue with this provider because they haven't done blood tests for like, a long time. And when you look through the notes of some providers, them not do no blood tests. They're not doing any testing on the patient. They're working with patients and the patients are diabetic. God bless the amount of A1C that they did on the patient. The A1C could have high from here to Jericho. Not one. It's the same thing for the cholesterol. And these patients are on cholesterol medications. Nobody not looking at their liver enzyme. Nobody not looking at their cholesterol. Nobody not looking at anything. It's like they're just ordering medication. What's the sense? What's the sense? We need to do better. We need to do better. Anyhow, how on a day going? Mine is going fine. All right. Let me go and see the remainder of my patient. And then from there, me is heading home. Bye.